Imagine a world less equipped to fight pandemics. A world where disease outbreaks spread faster and wider. That's the stark reality experts are warning about as the World Health Organization, WHO, faces massive staff cuts that could leave us all vulnerable. The WHO, the global organization responsible for coordinating international health within the United Nations system, is bracing for the elimination of over 2,000 positions, a staggering nearly 25% of its workforce, by June 2026. This drastic reduction stems from significant budget constraints following the United States' withdrawal from the organization. To put it in perspective, prior to the cuts, the WHO had 9,401 dedicated professionals working tirelessly across the globe. But here's where it gets controversial. Many believe these cuts, driven by financial pressures, will severely hamper the WHO's ability to effectively assist countries in managing and containing disease outbreaks. Think about it. When a new virus emerges, the WHO is often the first responder, providing crucial expertise and resources. Now, that response could be significantly weakened. WHO staffing cuts are a regrettable, but inevitable outcome of US withdrawal and lower than hoped for contributions by other countries, explains Pete Baker, Deputy Director of Global Health Policy and a Policy Fellow at the Center for Global Development. He emphasizes that the loss of expertise will leave the world less healthy and less safe. Baker further stresses the urgent need for a clear, strategic vision to navigate this new fiscal reality. He argues against cuts targeted at global and Africa-based staff, suggesting that the WHO should instead be bolstering its efforts in coordinating pandemic responses and providing essential support to the poorest nations, especially those in Africa. This perspective highlights a common concern that the cuts are disproportionately affecting regions that are already the most vulnerable. The impact of these cuts will be felt globally. The WHO headquarters in Geneva will lose the most positions, 805, while the African Regional Office will see a reduction of 638 out of its 2,541 posts. This is particularly concerning, as Africa faces numerous health challenges, including infectious diseases and limited access to healthcare. Dr. Githinja Gitahi, CEO of AMREF Health Africa, acknowledges that the cuts were anticipated but expresses concern about their rapid implementation and lack of transition planning. He warns that crucial functions like disease surveillance, supply chain management, and emergency response will inevitably suffer. This means African governments will need to shoulder a greater burden than before, potentially straining already limited resources. Eloise Todd, Executive Director and founder of Resilience Action Network International, echoes these concerns, stating that reduced capacity will severely impact the WHO's ability to fulfill its mandated role, especially at a time when global health threats are increasing. And this is the part most people miss. While the WHO aims to achieve roughly half of the staff reduction through natural attrition, such as retirements and the end of temporary contracts, the remaining positions will be eliminated entirely. This process has reportedly caused significant turmoil within the organization, with junior staff expressing concerns about senior staff being shielded from the cuts and high-cost positions being maintained. An anonymous open letter circulated in August raised these issues, highlighting potential inequities in the restructuring process. WHO Director General Dr. Tedros Adhanom Ghebreyesus acknowledged the challenges in an email to staff, describing the year as one of the most difficult in WHO's history, and referencing the painful conversations with staff who expressed their pain, anxiety and, in some cases, their anger. According to documents presented to member states, the number of senior directors will be reduced by 42%, returning to 2017 levels. Similarly, the number of entry-level professionals will decrease by 37%. This restructuring raises questions about the long-term impact on the WHO's expertise and capacity to respond to global health crises. Michel Kazachkine, a senior fellow at the Global Health Center, Geneva Graduate Institute, describes the WHO's presentation as a politically correct document showing how the balance between grade, regions, gender, etc., has been kept in the 2,000-plus cuts that were announced. He criticizes the lack of transparency regarding the decision-making process at the senior level and whether individual merit was prioritized over other criteria. Kazachkine argues that the WHO needs a clear mandate from the World Health Assembly, defining its core responsibilities and identifying areas that can be delegated to other organizations like UNICEF or the Global Fund. He advocates for a strategic fundraising approach based on a clearly defined budget and human resource needs, rather than simply adjusting manpower and activities to financial constraints. He believes that the cuts are not necessarily irreversible, and emphasizes the importance of adequate funding and staffing to maintain the WHO's independence in a politically charged environment. Dr. Ghebreyesus explained that the WHO faced financial challenges even before the US withdrawal and had been working to diversify its funding mechanisms. However, the US decision, along with funding cuts from other countries, resulted in a significant salary gap. He also highlighted a funding gap of $1 billion for 2026 and 2027, urging member states to provide support. These cuts raise fundamental questions about the future of global health security. Can the WHO effectively fulfill its mandate with a significantly reduced workforce? Will other organizations step up to fill the void? And what responsibility do individual nations have in ensuring the WHO has the resources it needs to protect global health? What are your thoughts on the priorities of the WHO and the impact of funding decisions on global health? Do you believe the cuts are justified, or do you think they will ultimately leave the world more vulnerable? Share your perspective in the comments below.